Ever wondered what a stroke really is? It's a term we've all heard, but what does it mean exactly? Simply put, a stroke is a sudden disruption in the blood supply to parts of the brain. It's like a power cut, but in this case, the power is the blood, and the building is your brain. There are two main types of stroke. First, we have ischemic stroke, which is when the blood flow to the brain gets blocked. It's a bit like a traffic jam in your blood vessels. Then there's hemorrhagic stroke, which is when a blood vessel in the brain bursts or leaks. You can think of it like a water pipe bursting, but instead of water, it's blood. It's crucial to understand that a stroke is a medical emergency. Immediate attention is required because the longer the brain is without blood, the more damage is caused. So, a stroke occurs when blood supply to your brain is interrupted or reduced, depriving brain tissue of essential oxygen and nutrients. So, what causes a stroke and what happens when you have one? In most cases, a stroke is caused by a blockage that cuts off blood flow to the brain. This blockage can stem from various factors, including high blood pressure, smoking, and heart disease. When blood flow to the brain is interrupted, it starves brain cells of oxygen, causing them to die. This can result in serious repercussions, depending on which part of the brain is affected. Some people may experience paralysis, typically on one side of the body. Others might find it difficult to speak or understand speech. Memory loss is also a common effect of a stroke. The effects of stroke can be severe and long-lasting, affecting a person's ability to move, speak, and remember. It's a serious condition that can drastically alter a person's life. Therefore, a stroke can have severe and lasting effects, but the key to minimizing damage lies in recognizing the symptoms and acting fast. How can you tell if someone might be having a stroke? Recognizing the signs is crucial and could save a life. We use the acronym FAST to remember these symptoms. First, look at the person's face. Is one side drooping or numb? Can they smile evenly? This could be a sign. Next, pay attention to their arms. Is one arm weak or numb? If they try to raise both arms, does one drift downward? These are warning signs as well. Speech is another area to monitor. Is their speech slurred? Are they unable to speak, or are they hard to understand? If they try to repeat a simple sentence, is it correct? If not, it's time to act. Finally, time is of the essence. If you observe any of these symptoms, even if they go away, call emergency services immediately. Remember, when it comes to a stroke, every minute matters. The faster you recognize the symptoms and get help, the better. What can be done if you or someone else has a stroke? Well, the treatment strategy depends largely on the type of stroke. For ischemic strokes, where blood clots block blood flow to the brain, medication is often used to dissolve these clots. On the other hand, hemorrhagic strokes where bleeding occurs in the brain typically require surgery to control the bleeding and reduce pressure on the brain. In addition to these medical treatments, certain herbal remedies may aid in recovery. Ginkgo biloba, for instance, is believed to improve blood flow, while garlic is known for its potential to lower blood pressure. But remember, prevention is always better than cure. Adopting a healthy lifestyle is key in preventing stroke. This includes a balanced diet, regular exercise, and abstaining from harmful habits like smoking. In conclusion, while a stroke is a serious medical condition, prompt treatment and lifestyle changes can greatly improve outcomes and prevent future strokes.